So Diego presented his hind end to me. I'm sitting on a step here and he came and presented his hind end to me. This is really nice muscle here somewhere. They're called the Soleus, the sun muscle in this area. And then what's quite interesting is that there's this piece of skin, almost just skin here. But it's a little Frisian that can jump up a storm. And what's just interesting is that he says this muscle's a little bit uncomfortable. Sometimes it's so good just to hang with them, you know. Make yourself available. Noble, come and tell you. So he's one of the school ponies, good boy. Whoopsie daisy. It's just you. Whoopsie, it says there. No, see now that feel. Oh, I don't like that feeling of being here. Let's change sides. So as much as what he's presented himself to me on, that's a release when they lift the leg up like that. But I don't like the way this, it's so behind him. You know, not to say he's going to kick me, but the thing is, maybe he is. It's not like milking a cow, or maybe it is. So I don't know what he's saying with this leg now. It's like he doesn't know which leg he wants me to work on. Is it in here, my love? So the adductor's in here. Oops, this is forming. The adductor's in here, up here. There's a soleus, there's a nerve. The saphenous vein, sorry, not a nerve. Well, there is a nerve, but anyway, it's a saphenous vein. It's very interesting that he's come to ask for this Soleus. There's acupoints here as well. One here. What does he say? Diego. So I'm watching his eyes and his ears. He says that was uncomfortable. And of course, I'm not comfortable with this position. You know, tail's right here. What's on its tail? I really know it's not the safe. Don't do as I do, hey? Don't do as I do. Do as I say. Never sit on a little stool behind a horse. Even if he's presented himself to you, don't do it. Look how close that is. That's my feet sitting at this angle. So I'm going to do some acupressure stuff on this one. So good for them, hey? So when he's doing that, we want the hip to drop, but not the whole body to twist. So if you see that the body's twisted, we want the body to stay up straight, but this hip must drop. And what's happened is he's dropped the hip and twisted his body. So his body must stay up, but the one hip, like that. Yes, like that, dude. And that one's dropped, this one's still straight. So that leg stays straight, but this one's dropped. So when that happens, the pelvis, there's a symphysis. We won't go in there too visually. So we want the pelvis to, it's like a Felden. Look at the breathing and look how unbalanced this tummy is compared to this side of the tummy. Can you see it? Now he's going to drop the other one, but his whole pelvis tips here. And he can't do it. He didn't try. So his right belly sticks out more than his left. Now he's going to ask me to do something else. What here? Quite fascinating. So we're going to do sternum, I think. This is not sternum. We do tummy. This is not tummy. Maybe hind legs still. Oh, no. Oh, okay. So what he wants me to do is he's push the sit bones 1 sit bone, 2 sit bones. So I'm going to get up. I think we did this before for him. So he will remember this. Wait, boy, wait. Let me just get, wait. Good stretch there. So it's my weight, my leaning weight into his sit bone. He's leaning back. If I had to let my arm go, I would fall down. So it's the symphysis sit bone. Oh, yeah, there. I actually need to change the camera so that the push hand is the hand that's this way. Let me see if it can see it. First before I push. Yeah, okay, wait. Now I'm pushing. Wait. That hip's trying to drop. I'm going to push this one. I actually need to do 2 hands, so I'm going to switch the camera off to do 2 hands, because 2 hands I'll have this hand on this side, and I will have this hand on this side. And then we'll push it, and he will push back, and we will release. And then I'm going to do the tail pull, which is just taking hold of the tail, leaning my weight back, and he pulls forward. Okay, I need 2 hands to do this as well. One's not strong enough. No, let's do that quicker.